Hi, everybody. Let's talk today about meds used to treat cancers. The medications are known as anti-neoplastics. Under normal circumstances, our body's cells can regulate their own growth. Growth genes are activated when cells begin to die off, and suppressor genes slow down replication, and there is normally a balance of activity between the two. Cancer occurs when there is genetic damage to growth-promoting genes. This genetic damage could occur secondary to environmental, hereditary, or viral causes. Cancer cells take on different characteristics from healthy cells. Their replication and growth don't respond to the usual genetic controls, so they divide more quickly. Cancer cells also invade not only nearby tissue, but have a propensity to move to other areas of the body, what we call metastasis. Next, cancer cells also have a tendency to live longer than healthy cells. Finally, tumors, or the abnormal growths that develop, are able to generate the development of blood vessels to nourish their tissue. We call this development of blood vessels angiogenesis. When it comes to treatment of cancer, prevention is key, although it might not be 100% achievable. Strategies like diets high in fruits and vegetables, exercise, avoiding obesity, avoiding excess alcohol, smoking cessation, and avoiding known carcinogens are useful primary interventions. Screenings are useful secondary interventions for the earliest possible identification. The earlier we treat, the smaller the size of the tumor and the less chance of metastasis. Therefore, the better the prognosis. If a cancer has been identified through labs or diagnostic testing, there are different treatment modalities available, such as radiation, surgery, immunotherapy, and chemotherapy. A combination of treatment modalities will often be used since the goal of treatment is 100% cell death. We'll focus today on chemotherapy and immunotherapy. Now, here's some characteristics of chemotherapy. First, they are developed in order to target fast-growing cells. They disrupt various stages of the cell cycle, the stages involved in cell division. Combinations of chemotherapeutic medications are given to interrupt different stages of the cell cycle. Combination of meds also allow for lower doses of each med that is given. Now, these medications must have known effectiveness against the particular cancer, and the effectiveness has been established through research. Finally, meds with overlapping toxicities are avoided when these combinations are chosen. For example, you wouldn't give two chemotherapeutic medications that have a tendency to cause neuropathies. We'll move on to some more characteristics on the next slide. Most chemo is administered through intermittent dosing. This allows normal cells to recover from the adverse effects, since chemo meds are usually toxic to healthy cells. Routes may vary. The most common routes are PO or oral. Oral routes are easy to administer and convenient. although the absorption of the medication is variable. The PO route helps to avoid some of the adverse effects that accompany more invasive routes. IV administration is the most likely route to be used and allows for consistent dosing. There are multiple adverse effects associated with this route, though, tissue necrosis and phlebitis being among them. Because anti-neoplastics are vesicants, a central line might be used in order to help prevent extravasation. Other routes might include intrathecal and intraperitoneal. Now, I do want to make one important point, and that is chemotherapy kills the cancer cells, but we also depend on the client's own immune system to neutralize the other cancer cells. As I mentioned before, all chemotherapeutic agents have the potential to cause toxicity and to kill healthy cells. Myelosuppression, suppression of the bone marrow, is one of the most essential adverse effects to understand. Because chemo targets fast-growing cells, those cells that have short lifespans are most susceptible for destruction. Now, these cells would include red blood cells, white blood cells, and platelets. Of special importance is the nadir. That is the time after med administration when RBCs, WBCs are most depleted from the myelosuppressive effects of the medication. Bleeding and neutropenic precautions may be necessary. Some medications can affect the cardio system. They can be cardiotoxic, like the medication doxorubicin or adriamycin. Clients will need cardiac monitoring while receiving this medication. Anti-neoplastic meds can also activate the vomiting center in the medulla, so nausea and vomiting are very common adverse effects. Antiemetics like Zofran are frequently given 30 minutes prior to administration of chemo. Cisplatin is nephrotoxic and can cause kidney failure, so you will need to monitor I and O and ensure adequate hydration when clients are taking this medication. Mesnex is a medication that might also be given. This helps to prevent hemorrhagic cystitis that can occur with administration of cisplatin. Still, other chemotherapeutic meds, like alkylating agents, can cause infertility. Also, nervous system functioning can be affected by chemo meds. Vincristine can cause peripheral neuritis, so frequent neurochecks are needed. Other adverse effects to discuss. Chemotherapy can also cause tissue death. These meds are what we call vesicants. If the medication leaks into surrounding tissue, it's essential that you, 1, cool the site, 2, elevate and rest the extremity. Also monitor for pain and swelling. Pain and swelling past 48 hours may require surgery. Another common effect is fatigue, very common adverse effect. The fatigue could be due to anemia or nutritional deficiencies. Hair follicles are also affected, and alopecia, a temporary balding, is common. It might take about 5 months after treatment for hair to be restored. Clients can wear hats and scarves to help deal with the body image disturbance. Other possibilities are carcinogenic effects, where a secondary cancer develops, teratogenic effects, which may necessitate the use of contraceptives, and blood dyscrasias like hyperuricemia. Meds used to treat cancer include multiple classes that all help to kill the cancer cells. Alkylating agents like cyclophosphamide or Cytoxan would be one group. This medication binds to the cancer DNA, breaks apart the DNA strands, and disrupts replication. It is used in the treatment of blood cancers like leukemia, as well as genitourinary cancers. Myelosuppression is common, and nadir can occur 9 to 14 days after the treatment. If red blood cells and white blood cells drop to dangerously low levels, treatment will be withheld. Clients will need to be placed on neutropenic precautions, bleeding precautions, and may need administration of filgrastim, which stimulates growth of neutrophils, or erythropoietin, which stimulates the production of red blood cells. I will move on to a different class of medication, and those would be the antimetabolites. Antimetabolites mimic the action of vitamins like folic acid that are necessary enzymes in DNA replication. Cancer genes mistakenly bind to antimetabolites instead of the usual enzymes, and replication is thereby prevented. Normal cells can be injured by this process, so leucovorin may be administered to take the place of folic acid and allow DNA replication in those healthy cells. Now, methotrexate is a widely used antimetabolite and is also used in the treatment of autoimmune disorders like rheumatoid arthritis. It is effective in the treatment of leukemias and sarcomas. Methotrexate has a tendency to cause myelosuppression, especially if given with an NSAID. It has been known to cause hepatotoxicity and GI bleeding. In addition, opportunistic infections may develop. In short, use cautiously in clients that either experience infection, liver dysfunction, peptic ulcer disease, or clients with known impaired bone marrow functioning. Some important patient teaching. Do not take folic acid supplements, which will disrupt the action of methotrexate. Limit caffeine intake. Large amounts will decrease the action of the med. Don't take over-the-counter pain meds unless you have consulted with your doctor. Finally, methotrexate is a Category X medication. Use contraception for 4 months after treatment has ended. Anti-tumor antibiotics like doxorubicin break apart DNA strands and prevent DNA synthesis. This class of medication is used to treat hematologic cancers and solid tumors. Adverse effects include myelosuppression, alopecia, nausea and vomiting, and with large doses, cardiotoxicity could occur. Hepatotoxicity is also possible. Interleukins, like aldesleukin, also known as proleukin, stimulate the immune system to attack renal carcinomas and melanoma. There are several effects that these medications have in stimulating the immune system: proliferation of T cell, increased production of antibodies, enhanced action of killer T cells, and enhanced action of natural killer cells. The most serious effect from aldesleukin is capillary leak syndrome. Intravascular components like albumin and fluid escape into the tissue, and severe fluid retention can occur. The client could gain 20 to 30 pounds and then develop heart failure, respiratory distress, or experience a myocardial infarction. Capillary leak syndrome is reversed when the medication is stopped. Other side effects include fever, chills, rash, and fatigue. Aldesleukin can interact with several other medications. When used with anti-anxiety or antipsychotic meds, mood disturbances could occur. There is also an increased risk of bleeding when used with NSAIDs. So that's my very, very brief introduction to oncology medications. Hope you enjoyed it.